Hello and Assalamu alaikum. My name is Dr. Navid Iqbal, and I'll be talking today about substance abuse, substance use, and addiction in Pakistan. These are topics that I really care about because when I moved back to Pakistan, I realized seeing some patients that there's a general lack of knowledge about substance abuse and substance use among medical professionals, be it psychologists, even medical doctors. We are just not that aware of the kind of substances that are being used and how to deal with patients or identify what they're using. So one of the problems was कि patient आता है, patient को खुद नहीं पता होता कि वो क्या use कर रहे हैं, especially the ones who are not that educated. They're not aware of what substance they're using, and what ends up happening is that people just label them as whatever they think they're using. So medical professionals might mislabel the substance, and hence the treatment for the substance might be different. So what I've done in this presentation and lecture is, okay, I've researched the data on Pakistan and what are the substances and what are the trends of substance use in Pakistan, and we will just work towards acclimatizing ourselves and knowing more about what these drugs are, how to identify कि कौन बंदा कौन सा drug use कर रहा है, just by how that drug makes them feel or how that substance makes them feel, or how to identify when there is a problem and what are the outcomes of substance use or that particular substance's outcomes, so that we can let the client or the patient know that this is what you are heading towards. So let's get started and see what we all can learn something from here. So first up, we talk about these are some statistics, overall statistics. Mind you, this research was done in 2013 with the WHO, and so things have just escalated since then. It has not gone down. So over here it says 4.25 million people are considered dependent on substances. That's 2.3% of your population. So these are people who are not casual users or who are not abusing the drug. These are people who are dependent and need help. What is unfortunate is कि हमारे यहाँ the facility all over Pakistan to treat people such as rehabs or inpatient psychiatric facilities that take addiction or addiction centers, these in total can only treat 30,000 patients or clients, whereas you can see the problem is far bigger than that. So there's a gap that is never filled, and people, unfortunately, most of them, our society just shuns them, ignores them, or hides them if their family is able to. Otherwise, people just throw those suffering from addiction onto the streets, and they just live on the streets until they unfortunately pass away. So this all can be changed if we raise awareness, if we help people early on. So let's talk about what drugs are being used. And over here you can see a list of 7 most common drugs or categories of drugs that are used in Pakistan. And the reason they're in this order is because according to the data we have, this is it is going from most used to least used. So by far the most used substance, and that was over 4 million people back in 2013, were using cannabis, marijuana, hashish, whatever you might call it. 4 million people are using it. Then comes benzodiazepines and other tranquilizers or sedatives. The third number pay, there's heroin and other opioids such as synthetic opioids, painkillers, and things like that. Then people use injectable anesthetics, and that's a huge array of drugs that can be used in that. Number five is something that is really growing and is making rounds in the news these days. Methamphetamine, commonly and colloquially known here as ice. Number six, there is alcohol use and abuse. And finally, there is cocaine use. So how we'll go through this is we'll first cover some definitions, and then we will start getting into individual substance or drug and talk about that. So what are the common methods that people use drugs? So some people might say, जी मैं cigarette में डाल के पीता हूँ, I snort, I inject. So these are things that we need to know what they're talking about, right? So one of the easiest things is ingesting pills. So things like the second common we just talked about is benzodiazepines, or commonly known here as sleeping pills. Wo are usually taken, you just take the pill like you take medication. Then there's smoking and inhalation. So how this is done is there are a number of ways to do this. What people commonly use is they take a cigarette, they cut it open, they add the drug onto the tobacco, they roll the cigarette back, and they light it and smoke it. You can also, there's rolling paper, and you can make joints out of it. Joint is just rolled up, crushed cannabis or any other medication or any other drug that you can add. There's also other ways. Over here it shows a pipe, so you can smoke it through a pipe, different pipes for different drugs. You can also use something that is called as a bong. So you light the drug at one end, the fumes and the vapors from it go through water and then filter out and then come out the other end, and you inhale it. So anything that is to do with inhalation, that is comes under this category. There's another commonly used term we will cover later when we discuss particular use for every drug. Then there's injecting, and people can inject into their veins, which is the IV intravenous, or they can inject the drug into their muscles, be it their thighs, arms, wherever they can find a spot. So that's the intramuscular over here. These are harder drugs, and people who are injecting, especially in their vein, are universally are really, really addicted and need help. Finally, there's insufflation, commonly known as snorting. So what usually happens is if you get a drug which is in powder form, or if you get like a medication, a pill, a tablet, people crush the tablet into fine little powder. आपने movies में देखा होगा, दिखाते हैं usually you make these lines using a razor or a card or anything. You roll up a piece of paper, usually a $10 bill, or the 20 रुपए का note करके, and then they block one of the nostrils and then they suck in through the other. This way, it's a fast way to get the drug and medication into your system. It crosses the blood-brain barrier easily, dissolves into the blood vessels in your nose and your sinuses, and you get an instant reaction or instant hit from it. So ये चार methods हैं जो कि which are very common ways universally to take drugs. People are very creative in taking drugs or using drugs. So there are other methods that are used as well. Okay, so before we start, these are some definitions that we need to know, because हमारे यहाँ लोग कहते हैं OG tolerance हो गई या उसको withdrawal हो रहे हैं. So we need to understand what these terms mean before we label someone with something. So let's talk about tolerance here. It says a state where the body no longer responds to a drug the same way when with the same amount that was being used. So what happens is that people have to increase the amount of the drug they're taking. Let's just take the example of alcohol. Someone who drinks, 3 drinks per night, after a couple of months, they don't feel the same buzz with 3 drinks a night. They have to go to 4, 5, 6, and this keeps on going up and up because you develop tolerance to the drug. Your body becomes tolerant and used to having that drug, so it does not have the same effect. So you increase the dose. Dependence is where a person functions normally only in the presence of a drug. So we'll talk about later, once again, using the example of alcohol, where people cannot function without the drug anymore. They wake up, the first thing they want to do in the morning is to have a drink. And that is because they cannot open their eyes, they cannot function, they cannot get out of bed. Similarly, people who have who are using other substances might go through this, where they just are now dependent on the drug or the medication. Finally, there's withdrawal. So what is withdrawal? Withdrawal is basically abnormal physical or psychological symptoms that you experience when you're not taking the drug anymore. So things like, tremors, or things like, vomiting, nausea in case of heroin, are things that we might need to consider when we're talking about withdrawal. जब आपके drug नहीं मिल रहा तो आपकी body के अंदर से एक चीज़ चली गई है जो कि इसको पसंद थी. So now it is acting up. It wants that drug again, but once you're not getting it, it will, act up and present you with some nasty symptoms. So what is important to know is that there are 3, or at least technically there used to be 3 categories. First of all was substance use. Then there's substance abuse, and then there's addiction. So there's a difference between the 3. There's a spectrum. It's not a clear-cut thing. Whereas, so if you see Western societies, or places where alcohol is integrated into culture, there people drink alcohol. And even in Pakistan, most of the people who drink alcohol or consume alcohol are casual users. They are drug users, or substance users. Whereas so we cannot say if someone goes out on a weekend, drinks 2 drinks and comes back, he is addicted, because he's not. He's using a substance. Then comes a state where you're abusing the substance. And then eventually, or maybe that never happens, comes a state where you are addicted to a substance. So those are different scenarios. So 4 major differences in this are mentioned over here. So number 1, it says substance abuse can appear casually, while addiction has serious problems. So the same example as I said, weekend pe jaake 2 drinks koi peeta hai, or 4 drinks peeta, let's say, that's abuse. But when it's addiction, is that same person will have a drink every day. He'll have 4 drinks every day. Okay. Addiction is when you have withdrawal symptoms, or significant withdrawal symptoms. Substance abuse, you do not have withdrawal symptoms. So people who smoke cigarettes will sometimes tell you कि I can quit anytime because मुझे तो कोई नहीं symptoms नहीं होते, withdrawal नहीं होते. So they might be users. Then it says addiction is considered a mental disorder or disease, while substance abuse is not necessarily a diagnosis. I disagree with this, because we will cover in a bit where DSM-5 has changed the definitions, and there is substance abuse and substance and addiction are 2 different diagnoses. Anyway, then number 4, substance abuse alters the brain briefly, while addiction alters the brain permanently. And that is true when there's something known, there's a phenomenon known as the addictive brain. In psychology, it's just very common. आपको दिखाते हैं कि how someone who has an addictive personality and how their brain function has changed, and how they and there have been studies done, neurophysiological studies that show the actual structure of the brain changing in people who were suffering from addiction. Okay, so DSM-5, as we all know, is a set of rules, a criteria, a book that dictates in the US, that dictates or gives you definition or criteria for every disorder. So what has happened from DSM-4 to DSM-5 is that the criteria has changed. It talked about it has now defined things in a broader perspective. So the major category here is substance-related and addictive disorders. So under that is further divided into substance use disorders and addictive disorders. So let's say, and then it goes through each substance. So let's say first example in the DSM is alcohol. So it will then go into details. So similarly, it goes into caffeine and cannabis and opioids, and all these categories have different definitions, and they're subdivided into, let's say in alcohol, it's like alcohol use disorder, alcohol intoxication, alcohol withdrawal, other alcohol-induced disorders, unspecified alcohol-related disorders. So all these disorders, they just substitute alcohol with like cannabis or heroin or opioids or something of that sort. So the categories remain the same. I have put while we were talking about alcohol, I put the disorders and the definition or the criteria for alcohol use disorder here. I've not put for other drugs and substances later on because it's honestly the same as we continue, so there's no need to go into details or post this again and again. You can use this as kind of a framework to judge the criteria for others. Briefly going through this, you have to have a couple of these in order to understand. So it says at least 2 of the followings within the 12-month period. It's very self-explanatory. You can go through it. For instance, one says large amount of alcohol is consumed, efforts to cut down, great deal of time spending getting alcohol, drinking alcohol, recovering from alcohol, great cravings, failure at school or social responsibilities. Seeing that there's that the substance is causing problems, but still using it is one. And then if you go on, so there's it also talks about tolerance and withdrawal. So once we have 2 of these at least, then we know that person is suffering according to the DSM-5 with alcohol use disorder. Okay. So that's a huge list to remember. I mean, it's counterintuitive. It's very intuitive. Sorry, to go through it. आपको वैसी sense बनती है कि अगर ज़्यादा पी रहे हैं उनकी social life affect हो रही है, this and that. So those are things that should be self-explanatory, but at the same time, we have what we could do is we need something more concise. Especially this works and is tested for alcohol. We use it in the medical field a lot. It's very simple. It's called a CAGE questionnaire, CAGE, and what it is basically it talks about have you ever tried to cut down on your drinking? That's the C for cut down. Are people annoyed and criticize you for your drinking? That's A. Have you ever felt guilty about drinking? That's the G. And have you needed to drink early morning to open your eyes? So eye opener is the E. If you have 2 or more of these, then that's concerning, and that indicates that you might be suffering from addiction. and this can be substituted. So C भी same रहेगा, A B G B, eye opener B. You can use this for other substances such as cannabis or heroin or opioids or anything. So it, even though it is strictly for alcohol, I assume for our intents and purposes, this can be a good framework to start asking these questions to our clients or patients. While we were on the topic of alcohol, I thought we can start with it, and then we'll go according to the list we had of commonly used substances. So alcohol, according to research, not commonly used in Pakistan, but from what I have experienced and I see, there's two peaks. If you see the socioeconomic graph of alcohol use, the two peaks. One is the people in villages who are not very educated. What they're drinking is homebrew. They make their alcohol themselves and drink that. And then the other are upper middle class or higher upper class who have the ability to afford alcohol, and they have bootleggers or dealers who are able to supply alcohol to them. Common amongst college-going students and most typically middle-aged people of wealthy background. So what does it look like? Alcohol, I'm sure a lot of people know how it looks like. It is a spirit, so depending on what type of alcohol there is, it will look different colors. For instance, vodka is transparent, whereas whiskey might be brown. And what is important for us clinically to know is that there's difference between hard liquor and things like beer and wine, which have far less concentration of alcohol. So a glass of wine is not the same as a glass or a drink of, let's say, brandy or whiskey. So that is to keep in mind, because alcohol in beer or wine is usually 12% or less, or even less than that. Beer is very diluted, so 5% at for most commercial beers, whereas the percentage of alcohol in let's say vodka is up to 40%. So there's a difference in that. So what might people say? So not everyone, as I said, some people from in the villages or some people who are not that informed might not use the term alcohol or beer or whatever they're drinking. What they would say is things like, sharab, daru. There's something, apparently they also call it dawa and dawai and bottle. There's something called desi tarra and or desi sharab. It's basically, that is something that we need to be really concerned about as healthcare professionals. What this is what I was talking about earlier. This is a home brew. People brew it at home. What happens is the dangers of that are that you do not ferment the alcohol completely to ethanol, and it is left to have methanol, which causes blindness. So that is really concerning. If someone calls in and says that I brew alcohol at home, or we need to let them know that these are immediate consequences. That's not a consequence, let's say 10 years down the lane. That's a consequence you could face a couple of months or weeks from there. How is it used? It's just you drink alcohol. People might drink it directly. People might mix it, especially hard liquor. People might mix it with soft drinks such as soda, Coke, Pepsi, Sprite, whatever, or some juice. But we need to know, back to the point where I was talking about hard liquor and beer and wine, we need to see how much the person's drinking, because it's the quantity of alcohol that would affect the effects of it. The more you drink, the more intoxicated you are, the worse it is for your health. Okay, so how does alcohol feel? You take a drink, 20 minutes pass by, you feel your mood's better, you have more confidence, there's this lack of inhibition. So let's say I was out somewhere and in a gathering, and I'm a shy person and I'm not able to talk to people. So I have a few drinks and then I'm not that shy anymore. And that's mostly why people drink alcohol in gatherings. It reduces anxiety. Some of the negative symptoms are that your words would be slurred, so you might slow down, you might mumble up the words because your coordination and your brain functioning is being kind of poisoned. So but that usually comes later on when you're really intoxicated. So the problem is coordination problems. You might not be able to walk straight, you'll bump into things. So that's another thing. Eventually, sedation. So alcohol is an interesting substance because it works both as um, a upper and a downer. What uppers and downers are, if you go back here into the slide we had initially. So their uppers are substances that lift you up. Your mood is better, you're more energetic. Downers are things that relax you, you'll fall asleep, you will be very relaxed. So over here, just by chance, the list goes from downers to uppers. So cannabis, benzodiazepines, heroines, injectable anesthetics. These all things help you relax, you fall asleep, you are calm. Whereas methamphetamine, small doses of alcohol, and cocaine, these are things that lift up your mood. You're more active. You're able to do a lot of things. Okay, but coming back to alcohol, how that is both because when you start drinking alcohol, you get an energy surge, you have all these symptoms, you lack of inhibitions, you're more confident. But as you keep getting intoxicated and keep on drinking more, you will see that your those sedative effects or the downer effects keep kicking, and you won't be able. You'll fall asleep as people pass out or black out, where they don't remember what happened and they just fall asleep because they're so intoxicated. So what are the dangers associated? So when a client calls us or a patient comes to your clinic, you tell them about the dangers of drug abuse, right? So in small quantities, people drink alcohol. That's okay if they're aware of what they're doing, but they need to know that there are consequences of it. So let's say, as I was talking about, there's impaired coordination. You're not able to walk. So you kind of bump into things. You might fall down. So old people sometimes fall down, and that can hurt them a lot. What happens and what usually makes the rounds in news over here in Pakistan is that a lot of people, because they're young, mostly young people who go out to, let's say, a friend's house or parties, then they drink a lot and then they get into behind a wheel to go back home rather than taking a taxi because for whatever reason. And usually what happens is that people feel confident because they have had the last drink 10 minutes before leaving and they're like, oh, I don't feel drunk. But alcohol levels rise slowly in the body, and when they start getting behind the wheels, alcohol kicks in, their coordination's out of whack, they cannot stop the car before. What ends up happening is that some poor guy on the streets who is just walking, minding their own business, is run over just because someone was intoxicated behind the wheel. So highly discourage people not to drive, not to ride a motorcycle or anything when under the influence of alcohol. Uh, you make poor decisions and choices when intoxicated. Usually, let's take the example here of being at a party. Young people, college going students, are at a party. They might do things that they would not have when they were not intoxicated. As you said, inhibitions are low, so they might do things that they might regret. You might end up being a victim by someone who is there to prey on you, be it financially, they could rob you. You could be so intoxicated that you would not be able to provide consent, and this unfortunately, there's a chance of sexual harm. So those are things that people need to be educated upon, and to use the substance in moderate amount and where they can control it. Coming back to the point of homebrew, when they see sharab or they see tara, the problem with that is that it has methanol, can cause blindness in just a few doses as well. And then there's like chronic use of alcohol over years. If you keep on abusing alcohol, apart from all those other problems that you have, there's serious health problems. You'll develop chronic liver failure that is irreversible. So the only solution out of that would be a liver transplant. And at least what happens in the West is that you are far below on the transplant list if you if your liver failure is because of alcoholic hepatitis, because it is thought that you kind of led yourself to it. That's a different debate, but the problem is that you can have serious health consequences both on your cardiovascular system, so your heart, your liver, your lungs, your kidneys, all are affected, and especially your mental functioning is affected. Finally, and this is there's something called hangover. So what happens is that alcohol depletes your body from nutrients and electrolytes. You and if you drink a lot, you fall asleep, not knowing, and in the morning when you wake up, you feel terrible. The symptoms are that of a headache. You have you feel like you have to vomit. You don't want to look at lights. Bright lights give you a terrible headache. You don't feel like doing anything or getting out of bed. So think of it like if you drink heavily on a Tuesday night and you have to go to work, you might not be able to go to work, and you can call in sick once, twice, but if you're abusing alcohol on a daily basis, you might not be able to do that, and that would affect your work and social life and so on and so forth. So those are serious dangers of alcohol. So what are withdrawal symptoms and how they come to play is usually these are not for casual users. These are seen in people who are abusing alcohol for a long time and are dependent on it. The alcohol withdrawal is honestly one of the things that would kill you. There are other very harmful drugs such as heroin, and they have nasty withdrawals, but a heroin withdrawal would be terrible. You would feel really, really bad, and you'd wish that it was all over, but you would not die from a heroin withdrawal in most cases. But in a true alcohol withdrawal, you will definitely, there's a high possibility that you would die. So what happens is a typical patient who has used, or a typical client who has abused alcohol for, let's say, 8 years on a daily basis, now leaves alcohol or for 3 days. After 3 days, this is what's going to happen, and they will definitely come into the hospital. Their heart rate would be really high, blood pressure would be high, they would be sweating, their hands would have a tremor. So you'd see literal shaking of the hands, uncontrollable, not under the patient's control. There'll be insomnia, they won't be able to sleep, there'll be vomiting, there'll be agitation, anxiety, can lead to seizures. But the most important thing that it can, and the most dangerous thing it can do is something called delirious tremors, or DT. What happens in DT is that people start hallucinating. So you feel, most commonly what people feel is that there are ants crawling all over them. That's what's called tactile or physical hallucinations. You feel something on your body, you hear things, you see things. I had a patient who came in after a long flight, stopped drinking alcohol 2 days before the flight, straight from the airport came into the hospital because he thought he was possessed. He was seeing the devil in the curtains of the emergency room, and we literally had to tie him down on physical restraints because he was freaking out. And that's just because he was using alcohol daily or abusing alcohol daily for 3 years, and now suddenly quit. And with the high heart rate, the heart rate can shoot up. You can have brain aneurysm, or your heart can actually stop. So these patients need to be admitted to the hospital. So what we can do is that if someone calls in and says, I want to quit, I've been drinking for 3 years, 4 years, constantly every day, what do I do? You refer them to a psychiatrist or ask them to check into a rehab facility, because alcohol withdrawal is a serious deal, and it can really be deadly. So what is the treatment? Briefly, as we talked about, treatment is discontinuation. If there's casual users, discontinuation. Maybe if they're just casual users, cut down on the alcohol. Then most important thing is supportive therapy. So Alcoholics Anonymous, AA, are very helpful in this. There's a group of people who sit around and talk about their experiences. All of them are sober now and have stopped using alcohol or abusing alcohol, and they all want to help each other. There are groups in every city. I know for a fact that Lahore has one, and they meet every Sunday. So these are very welcoming people, and they support you. They'll be a sponsor. A sponsor is someone who will be there for you, who has been sober and has quit using alcohol for some time, and will help you in any case possible. So these are very helpful groups in alcohol. Obviously, counseling therapy. These people might be using or abusing drugs for other reasons, and we need to find out through therapy and counseling what the problem is and get to the core of that. As I said, chronic users might be needed to be hospitalized before they quit. You tell them to visit a psychiatrist, consult a psychiatrist, because they might get them to use medications like benzodiazepines to calm them with their withdrawals. So yeah, that's pretty much it about alcohol. The next, we go to the most common drug used in Pakistan, and I would assume worldwide. The most commonly used drug is cannabis. Around 4 million people yearly use the drug. At any given time, it is estimated that 4% of the population uses it. Also, this is survey data we need to keep in mind, and also this was done in 2013, and there's no updated data. I am pretty sure there are way more people using cannabis now in 2019 than there were in 2013, and there are more people who do not report using cannabis. Cannabis is very popular, once again, amongst young adults or even kids in their late teens, unfortunately. This is one drug that is, I would say, even though it has more prevalence amongst men, but this is a drug or substance that is being used quite frequently by both men and women in Pakistan. The stigma associated with it has been reduced over the years, which just propagates the use and the access. So this and hashish are easily or readily available in Pakistan because of the Afghan-Pakistan border. Anyway, and that explains why it's most commonly used in KPK and in Sindh. Research shows that people begin using most commonly at 19 years of age, and the peak use is in those with 33 years of age. Let's talk about how it looks like. So basically, it's technically marijuana is a leaf. It's a plant that grows on a cannabis plant. You dry off the bud of the leaf. It's green, dried off plant. Then people process it into make it into hashish, which is this black brown tar mixture or paste. So in the next slide, I'll show you some examples of that. The local names for this there's a huge list. So commonly known as chars, hashish or hash, garda, dota. Edible or drinkable form is called pung, mixed with the cannabis butter or oil mixed in milk. Then some Western terms popular in urban areas are pot, weed, joint, and a joint in Urdu is called joda. Uh, Anyway, so how is it consumed? Usually, once again, consumed in a cigarette. You open up a cigarette, you add the cannabis or hashish in it, you roll back, light it, you smoke, inhale. You could also use it, especially hashish, you can use by using something called panni. What you use is you take an aluminum foil, piece of aluminum foil, you hold it, you put the drug on it, heat it with a lighter underneath. It would heat this up and fumes would be released, and you inhale the fumes through your mouth or your nose with the help of a straw. As I said, it can be mixed into milk to create bhang. Less common in Pakistan, but in the Western world, more common is things like edibles, where you basically extract the active components, THC, from the cannabis plant and add it to, because it's fat soluble, it can be added to butter. Once you have butter, you can basically make anything from candies to brownies to anything. But not very common in Pakistan. So over here, if you look, there is the plant, dried off buds of cannabis. They're usually green in color. Once again, are rare to find in Pakistan. Mostly this form on the right is farmed in Pakistan. This is hashish made into a mixture into pellets. You break it down into little balls and use that. An example of that over here, a joint being rolled with a mixture of dried off plant and these little balls or pellets of hashish. You roll it, eventually it looks like this, just like a cigarette, and you smoke it. Okay. So how does smoking or consuming cannabis feels? Smoking is rapid, so in a matter of 3 to 5 minutes, you'll feel it after smoking. You'll have slow perception of time. Everything stops. You feel relaxed. There's abstract thinking and philosophical thinking, so you would wonder, purpose of life and things like that. There's heightened sense of taste and smell and everything. So this leads to a common phenomenon known as munchies, because you feel that you want to eat, and food tastes much better because the receptors are more receptive to food and taste. There's pain relief, there's weightlessness, you feel weightless, like your body is stoned. You might sit in a place feeling very relaxed. Then some of the negative symptoms or some of the telltale times, someone might call in and say, my kid comes in, he's very aloof, his eyes are red. So most probably they're consuming cannabis. Their mouth is also dry, and that's something that's common with most of these substances. So what are the dangers associated with cannabis use? So as you might know, worldwide, especially in the US, they're legalizing cannabis just like alcohol, because it is thought to be not as addictive and dangerous, which is true, but everything should be done in moderation. And over there's actual shops and like a huge industry that is making standardized cannabis products. In Pakistan, there's not, and you don't know what you're smoking, you don't know how much you're smoking, you don't know the consequences, the legal consequences of it as well. So that's one of the issues. The bigger issue is, especially when you're younger, so your brain kind of still develops till 23 to 25 years of age. Before that, if you consume a psychoactive substance like cannabis, especially, it increases the chance or predisposition for psychosis. So that is a big concern, especially in people who are younger. In everyone else, there's something called the amotivational syndrome. So when you smoke or you consume cannabis, you're really content with whatever's happening at that moment. That's why the whole image of a couch potato is perpetuated with cannabis. You'll smoke up, you'll sit down, stone, happy with whatever's happening. So eventually you lose motivation to do much else than to just stay home. So I see examples a lot of younger people who get into smoking casually, and then what happens is that they start smoking at home, and they whatever they were doing in the past, they were socializing, they start to cancel that and prefer staying in and consuming cannabis on their own, and they're happy with it. So social life and school life and all of that is affected. We talk about social isolation. Then especially for men, there's weight gain for all, but for men especially, there's something called gynecomastia, which is basically development of breast tissue along with gaining weight in other parts of the body. Eventually, yes, as with any other medication or drug, there's physical dependence. What are the withdrawal symptoms? So cannabis usually does not have that strong of a withdrawal, but as we mentioned, more of a psychological withdrawal than a physical one. But things known for chronic users are restlessness, irritability, anger, anxiety, depression, sleep difficulties, and decreased appetite. What is the treatment? You taper off the drug, you try to cut down, just like smoking, you try to cut down. You encourage people to cut down if it's affecting their social life or their personal life. You discontinue this substance altogether. You provide a social network if they're saying that, oh, I'm being pressured to use this, or all my friends are using it. Maybe they need to find better friends, or they need to hang out with those friends when they're not smoking. As always, counseling and therapy. And eventually, if they have withdrawal symptoms and they cannot deal with quitting the drug, they might need to see a psychiatrist who might put them on medication such as antidepressants if needed. Okay, so now we come to the second most common drug or substance used in Pakistan. The problem, this is very alarming. I found this paper and I'll share the research statistics with you. This was for me very concerning as a medical doctor. The usage in peri-urban population, and this is like suburbs, Karachi mein hui thi research, is 14% of the population is using it. Ye research is tarah thi ke like you go to people's houses and you ask, your medical good condition mein nahi the. This is overall in those two populations. Generally pucha gaya logon se, and 14% of the people said कि जी ये we use some sort of benzodiazepines. Compared to the US, which is very liberal on all kinds of drugs, especially opioids and prescription medication, there 5.2% of the population was using this. Mind you, this research was done in 2011, so there's a little outdated. I assume the problem still remains at large. The mean age is 51 years old. Majority of the users, 67%, were females. Alarmingly, 44% of those were housewives. 31% had no formal education whatsoever, and the use was prevalent in people with less education as well. The mean, and this is surprising, the mean duration jitni der logon ne istemal ki hai was 3 years. 3 saal se 144 weeks people were using this. So this is not casual, use and abuse. This is serious, long-term, chronic abuse of medication, which can be deadly. So another alarming fact was that 75% of these people who were using it had not seen a psychiatrist. So psychiatrists ke paas nahi gaye. The majority of these were just getting it over the counter, asking pharmacists to getting a prescription from a relative, most of the times not getting a prescription whatsoever, ya phir being prescribed by a GP. So that's basically the core of the problem here. हमें लोगों को ये मिल जाती हैं without prescription. What I've noticed over here is that the big name pharmacies or brand pharmacies do not sell these without prescription. They would ask you for a prescription for lekin there's a ton of pharmacies every and around every corner there's a pharmacy, and sometimes you might just pay them 50 rupees more and they'll tell them. Sometimes you don't even have to pay them, just ask for the medication, they'll give you. The favorite, and I'd known this before the research as well, just through the limited clinical experience that I've had here, is Luxotinil. That's the brand name. Commonly Luxotinil log kehte hain. The chemical name is bromazepam. It's a medium acting benzodiazepine. Other names for bromazepam, Luxotinil ke alawa, क्योंकि medications have different names, but they're one and the same thing. So Luxotinil is also sold under the names locally as Sakoon, Relaxin, and Amaze. So you see how this is a problem as well. It's a big problem in the US, like in Pakistan, maybe this is a problem where these medications are being labeled as or are given very glorified name. कौन नहीं चाहेगा कि मुझे भी डॉक्टर सुकून की दवाई दे दे, because people who are on, and that explains why people who are who have less amount of knowledge or awareness or education fall for these. They're like, doctor साहब मुझे सुकून की दवाई दें, and they already call the medication literally sukoon, so they would be prescribed that, or relaxin, or I want to feel amazing, so amaze. So these things, there needs to be regulation of this, and people need to be told the truth about these medications or not. What I want you to know is that from what with the demographics जो बताए गए हैं, इसमें नजर आता है कि housewives are using this. It is basically something that people do not really concern themselves कि this is a bad drug or this is a drug as well. They're just like, oh, we use this medication because doctor ने कहा था या मेरी दोस्त खाती है तो उसको आसान हो गया था सुकून रात को सोने के लिए. This is the problem with these are that they are labeled as sleeping pills, which they're not. There's a whole different category of medications that are, sedatives and hypnotics. These are anti-anxiety medication that have the side effect of sleep. So people use these. Let's talk about how they're taken. Because they're a medication, they're taken in tablet or capsule forms. There are some injections that are available, but not a lot of people use those injections because they're harder to get. Even those shady pharmacies that give you tablets will not give you, let's say, a Valium injection because, that looks dangerous, and those can really be deadly. Local names, as I said, sleeping pills कहा जाता है ना, यहाँ पर आराम की सुकून की गोली दे दी डॉक्टर ने. Most of the time people don't even know what they're taking. And I've listed the brand names for commonly used medications. So the most common, as I said, was Luxotinil, which is bromazepam, also known as Sakoon, Relaxin, Amaze. Then the second most commonly abused benzodiazepine here is Valium, which is a diazepam, also an immediate moderate acting benzodiazepine, which also sold under the name as Waspam or Cerulean. Then I'd say the third most abused benzodiazepine in Pakistan is Alprazolam, which is commonly known as Xanax. But in Pakistan, the most popular brand, from what I hear, is ALP. So ALP कहते हैं लोग या ALP. This is being sold. Other brands are Zenith and Nuxem. Then there's clonazepam, which is sold as Rivotril or Epizep, Naze, Magura. These are not as attractive names, and clonazepam is a long-acting anti-anxiety medication, so people don't really use it because it does not have immediate effects that way. Then there's temazepam. Market में, this is short, very hard to get. This is very strong from compared to all of these. This really puts someone to sleep easily. known as Restoril, Calm, Hypnotin. Once again, you see the problematic names over here. Very attractive for someone who's having trouble for sleeping or something. How is it used? Once again, taken orally. Some of them come in drop forms. You can take drops with a dropper, and they're syrups and injections, but most commonly, a lot of people take tablets. So how does it feel? Why do people take it? The problem is, आपके घर में एक housewife है. She has some marital issues. She has stress. She has to deal with children. She has to deal with her husband. She has underlying, perhaps depression or anxiety that she never actually, dealt with. Or to be honest, in our culture, there's not a lot of, from what I see, there's communication gaps. So लोग communicate नहीं करते अपनी बात को दूसरे के साथ. What ends up happening is then that causes stress. Men, and this is what the research says, men usually spend most of the time, or majority of their time, or a big chunk of their time outside the house when they're in most cases in Pakistan, they're the breadwinners, so they go out, spend half the day at work, so they don't have to deal with poor. What happens with the women is that they're mostly at home, especially housewives, so they don't get that outlet. They have moved into a different house. There's so many stressors, so and they don't have healthy ways to cope with it. They don't have a social circle. They don't have other things. So what ends up happening is they want to feel relaxed, and then someone tells them, आप ये जी relaxin खा लें, या amaze खा लें, या Lexotinil खा लें, and they have one, and then they feel good. So they continue having that without knowing the consequences of it. So how it feels like is you have this mild euphoria and pleasure. You feel good. There's anxiety relief, and that's why it's prescribed to people who need it, because they're suffering from anxiety. And there's relaxation, and then there's a side effect of sedation. And that's the problem, where people use these to fall asleep, when that's just a subsidiary effect of these medications. The prominent effect is to relax you and calm your brain. And that's why these medications are also used when people have seizures. मिर्गी का दौरा पड़ रहा है, हिल रहा है कोई, तो आप diazepam, Valium inject कर देते हैं उन्हें. It just slows the brain. So in epilepsy, your brain is firing really fast, and your whole body is moving. These things just calm down the brain physically. So this is what they're doing on a lower scale or smaller scale when you're taking tablets. What are the dangers associated with it? So the problem with taking those medications are mostly long-term, and they're short-term problems as well. Just like alcohol, higher doses can impair your movement, so you might bump into things, you might end up into an accident, you might fall asleep at different places. There's extreme drowsiness. These are complicated medications which have interaction. So as we saw, average age 51 से above, 51 से above यहाँ पर पाकिस्तान में or anywhere in the world, people are on one or mostly polytherapy of other drugs. किसी को heart problem है, किसी को kidney problem है, and then you're adding another pharmacological agent on top of it without asking a doctor or without consulting them, then that can cause interactions with other medication. But the most important thing is it causes memory loss. So things with memory, your short-term memory is gone. So if you go on a binge abusing these medications, especially in higher doses, you might end up, and I've seen patients who come to the hospital or come to the clinic, and they say, Doctor Sahab, mujhe yaad nahi pichle 2 hafte kya hua tha. It's just a haze. And that's true, because they don't remember things. The ability to formulate memories is taken away from them because of the medication. So you can see how that is dangerous, because they can take decisions that they don't remember, say things that they don't remember, do things that they don't remember. And when we're talking about things like temazepam and stronger benzodiazepines, they have also been used as things as sinister as date rape drugs, where someone would give you, koi aapke drink mein mila dega, koi aap malai bhi nahi. If you're taking it especially by yourself, and you go on to a party or you go meet someone, and then you don't know what's going to happen because you won't remember it and they know that you won't remember it. So that leaves you very vulnerable to a lot of things. What are the withdrawal symptoms? So once again, just like alcohol, where it does not seem bad, or the medication or the effects do not seem bad, but the withdrawal can be deadly to and very severe. Once again, I've seen patients with benzodiazepine withdrawal, people who have gone on a binge for 2 months, suddenly stop taking benzodiazepines, and these people did not have panic attacks or anxiety before, but now they experience panic attacks and anxiety. And it is really bad because they will have tremors, they'll have sweating. So same things as we talked about for alcohol, pretty much tremors, sweating, muscle pains. They would not be able to concentrate. The memory lapses are still there. Eventually, long-term memory loss can happen. There'll be nausea, vomiting, insomnia, depression, a whole melee of things that would happen because you stop taking benzodiazepines. Um, so what is the treatment? The treatment is detoxification. You need to get these out. It takes about 3 to 4 weeks after your last dose to get them out of your system. You taper these medications down. That's how you do it, because otherwise you'll have severe withdrawal symptoms and can be really dangerous. So you have to see a psychiatrist. You tell the patient, especially जो हमने बात की women who are taking them for more than 3 years, you ask them to cut down, go consult a psychiatrist to cut down on these medications, and obviously there's counseling and therapy. So you tell them, because once the depression sets in or other things set in, you experience those things with it. Okay, moving on to the third most abused substance in Pakistan is heroin. Or opium, basically opioids, mostly used in Pakistan as heroin. 860,000 people use heroin in Pakistan at any given time. That's many users. The prevalence is significant. Most common in 21 years and above. 73% of the people using it are thankfully above 21 years of age. There are younger people using it. There 41.7% of people using heroin, according to this particular study in 2003, were people who had a monthly income of less than 6,000 rupees. An interesting fact is, as you notice, when the income gets more than 11,500 per month, the use drops to 14.7. So, and then the next statistics as well, where it says 45.1% of the people who use heroin are not educated. So that plays a huge role in for us to understand the demographics of people who abuse heroin. These are not people who are very educated or aware, and these unfortunately fall trap to heroin use. It is very cheap to get. It is readily available, and this is the demographic that use it. 32.5% of the people using it were production or labor-related labor workers. Most common demographically in Pakistan is used in Balochistan and KPK region. So how does heroin look? And we will show you examples in the next slide. Heroin can be a white or brown powder. It can also come in a form which is called black tar heroin, which is sticky substance in a form just like tar that's used on the roads. Local names, unfortunately, I was not able to find a lot of names. I know it's called afim and commonly known as powder or powder. So The thing with the term powder is this is commonly used for a lot of substances. We'll see later on as well when we talk about methamphetamines and other things. People would refer to these as powder because they come in a powder form. They don't know what they're taking, and that's why this presentation is useful for you, because you can then identify by the symptoms they're feeling how the high looks like and what they what these other character how they consume it. These other characteristics might help us identify what powder they're talking about. Okay, how it's used is smoked in cigarettes, as we talked about. They smoke on an aluminum foil called bunny. They heat it up. They smoke they inhale the fumes. Um, they also inject it. So once again, next slide will show. They usually what people do is take a spoon. They put the heroin powder or heat it up with some drops of water. It becomes a paste which can then be taken into a syringe, and people inject it into their veins or muscle. And finally, people also snort it through their nose. And this applies for all drugs overall. That obviously, and it makes sense that the more invasive the procedure to use, the worse it is for their health. So, and the stronger the high or the buzz or the effects of the medication or the drug are. So, smoking would not be that strong, whereas snorting would give an immediate effect, stronger. But obviously, then if they inject it, it will be stronger and into their muscle. And the strongest of all would be when they inject it into their veins. So those you need to keep those in mind. And as you go stronger, the problems associated with it increase. So here, if we look at on the left is, as I was talking about, you take a spoon, you add the powder, you heat it up with the lighter, it'll become liquid, and you take it into a syringe and you inject it. This is one example of a brown powder, and this is white powder. Both are heroin and can be used. Then I was talking about black tar heroin, which can be seen over here. It's just like a rock, tar crumbles and can be used. Over here, the whole inhalation through what we called bunny is shown in this picture, where a man is using a straw to inhale these fumes of the heated up heroin from, and someone else is heating up the foil underneath. Okay. Sorry. Moving on, how does heroin feel? So this is one of the stronger substances. It's a hard drug compared to like cannabis and alcohol, which are not known as hard drugs. But this is a hard drug. When you consume it or inject it, you have a rush feeling of euphoria. You have warmth throughout the body. You have instant pain relief because this is from the opioid family. Opioid family medications, opioids are painkillers such as morphine. So these are primarily used, or in the past were used, for pain relief. You feel like you're on a cloud, and then eventually there's drowsiness and sleepiness. So what happens is that the first four effects are noticed for 15 to 20 minutes, and then you end up into a deep sleep or sedation once you inject heroin. There's also a state called a term commonly used amongst users is called nodding. So what nodding is that you shift in and out of consciousness, where you would fall asleep and then wake up and then fall asleep again and again. So you would nod. And that is something that users try to achieve because it's pleasurable, apparently. So what are the dangers associated with it? Biggest danger with taking heroin is, so how I was talking about heroin being an opioid. What they do are that uh, they relieve pain. They also slow down your brain. But what happens is once they slow down the brain, there's centers in your brain that control your breathing and heart rate. They also slow those down. So when you give, let's say, something like morphine in high doses in a medical setting, such as during surgery or emergency room, you make sure you put a tube in their mouth so that they can breathe, they don't choke, they don't, they're able to maintain their heart rate and breaths. But outside, you're not able to do it. So the problem is, let's say, when someone injects it, especially in their vein, that's taking seconds to milliseconds to put into effect because your blood is constantly flowing and pumping, right? So the moment it enters your blood, within seconds, it'll be in your brain all over your body. So people fall asleep with a needle inside them most of the times. Thankfully, they use smaller needles, so that's not that big of a problem. But these needles, and I'll talk about the second point, these needles can stay inside and can cause what we call collapse of veins. So these veins would collapse and you would not be able to use the drug or inject in the same vein again. So what you would see patients doing is they'll try different veins all over their body. So they'll start with, the arm, then they'd use the back of their hand, then they'd go to the other arm, and then the leg, or you'd be surprised the kind of places people end up injecting themselves just because they've run out of options. What this does is, and this is one of the signs that you can tell people to identify, how you can identify, families can identify if people are using or abusing heroin or any other injectable drugs, that they will have what we medically call track marks. So आपके अगर वेन में यहाँ पर एक mark है from injection, then you'll have another over here, another here, another here. So they've just made like a track of these dots that they're places where they have injected it. So those are a telltale sign of usually heroin abuse. Coming back to the overdose, the problem with it is your mind slows down, your body slows down, you fall into a coma, and that's what overdose happens. I've seen people overdose, unfortunately, in front of me. Where we were in a facility that did not have, where we were not in a medical facility. We did not have tools to intubate people so that they could breathe. We did not have naloxone, which is medication used to reverse the effects of heroin. And unfortunately, the patient fell into a coma, and after 2 weeks, the patient expired. And that's what happens because you don't know how much heroin you are getting. So it's not standardized. Some dealer is dealing you out of their van or like very shady situation. So one time you use this much or like a spoonful or whatever, like 2 grams or whatnot. And the second time you use 2 grams, that second time might contain, let's say, 1,000 milligrams, and the first time was 500 milligrams. There's no standard, so you don't know how much can be too much. And also, as tolerance develops, people start using more and more, and the tolerance develops to you feeling the high and the psychological aspects of it. The tolerance usually does not develop to the heart effects felt on the heart and your breathing. So you might not be getting high, but your breathing and heart might be stopping to an extent where maybe chasing that high would lead you to be in a coma or just pass away directly. So that's very concerning. Thirdly, a big problem is, as we saw, the people who are using it are not of very high socioeconomic class. They cannot afford to buy new needles. What they end up doing is they start sharing needles. That is a big problem because a needle goes into your blood, into your vein, directly comes in contact with your blood. If I have any, or if someone who is using intravenous drugs has any chronic illness or infection such as HIV/AIDS or hepatitis C or any other infection, that can very easily get into that syringe and get into through that needle. And when the second person uses it, the blood comes into the syringe, comes into contact with that infection, that person can get HIV or Hep C or whatever disease they have. And dirty needles can cause other infections, which can lead you to amputate your arm or wherever you're injecting it. So that is a big question. So even if a client comes up to you and talks about heroin abuse, one of the first things to do is to educate them about needles, not sharing needles, and not using the same needle again. Okay. What are the withdrawal symptoms? So withdrawal symptoms are pretty severe. So we talked about withdrawal symptoms from alcohol and benzodiazepines. Definitely alcohol symptoms, if kick in, can be really life-threatening. The thing with heroin withdrawal is that it is not as life-threatening, but to the client and the patient, it will feel terrible. You will feel really bad. You'll have things like restlessness, racing heart, anxiety, shakes, shivering, sweating, extreme nausea and vomiting. You'll have muscle pain and an inability to fall asleep. So your body really wants to go back to those opioids, get that fix, because one fix will get rid of all of this. But the way we deal with it is we live through it. It will take 2-3 weeks. Eventually, once you've detoxed, your body will feel better. It is hard, it is very difficult, and mostly that's why people are admitted into rehab facilities where they can be facilitated to go through this process, because it is hard both for the client and their family to see them go through this. What is the treatment? Detoxification, as I said, it will take 2-3 weeks. You need to power through and feel better. There's a medication called methadone, which is also an opioid analog. You take this daily, and it gets rid of those withdrawal symptoms, and you'll not feel the withdrawal symptoms as long as, obviously, you start using. The problem with methadone is that we don't have methadone clinics like they do in the US. So you have to buy this out of pocket, and it is extremely expensive. And if we go back and see the demographic of people who use heroin regularly in Pakistan, they really cannot afford it. It's just for people who are able to pay, let's say, 4,000, 5,000, 6,000 rupees per week, or even per every other day, to get into those programs. Then there's obviously rehab programs that help, and at the end there's counseling and therapy that really help in long term to deal with this. Finally, let's talk about other opioids, because heroin is, as we said, an opioid, which is a painkiller, and this is more produced in the black market. But there's other things that are also produced pharmacologically that people abuse. So one of the things other than heroin is opium, known as afim. So that is comes from poppy plant, and very prevalent as well. Same demographic uses it, used the same way, and less. It's not as strong as heroin, but can have the similar effects. Then there's things like buprenorphine, which is brand names over here are Brupron or Prener or Norpin. These are actually ironically used to, just like methadone, these are used to help people with withdrawal effects and deal with that, but people still abuse these medications. Then there's codeine. Codeine is also a painkiller, usually found in painkiller medications and cough syrups. A point to note over here is कि codeine tablets में मिलती है यहाँ पर most probably, and how governments all around the world have tried to combat people abusing these is कि the tablets you get mixed with acetaminophen, which is basically Panadol. तो अगर एक tablet आपको मिलती है जिसके अंदर let's say 5 milligrams codeine है, it also has 300 milligrams or like 500 milligrams of paracetamol or acetaminophen. The problem with the way it is क्यों किया जाता है, एक तो दोनों चीज़ें पेन को हेल्प करती हैं, लेकिन the other way is to combat addiction and substance abuse. So there's a limit to how much Panadol, paracetamol, or you know you can take. So usually it is suggested of 500 to 1000 se zyada na lein. And the codeine in it is very small, so people would have to take multiple tablets to get that high off of codeine. But the problem with that is that they would be exceeding the Panadol or paracetamol amount in those tablets. So this is a point for psychoeducation for patients who are trying to do this. Can you tell them that you're taking way too much Panadol or paracetamol in this tablet, which is coming with the codeine, and that is damaging your liver very badly, and that could cause irreversible liver damage from just one dose, or very high dose of acetaminophen, and it can cause toxicity. So that is something that you need to keep in mind when someone tells you that they're abusing or using codeine. Then there's a painkiller, tramadol, that also comes with most of the times paracetamol mixed with it, but there's tramadol available that does not have paracetamol. It does not have very high abuse potential, but people still abuse it. Usually they take it orally in tablet forms. Yeah, what people might do is it comes tablet or capsule. They either crush the tablet or they open the capsule, take out the substance, and then they snort it to get that effect. Then there's morphine and fentanyl. Thankfully, Pakistan has very regulated, really extremely regulated morphine and fentanyl use. So these would be just people who have that access, people in medical fields who have access to morphine or fentanyl would be abusing these painkillers and opioids. Usually, general public में ये नजर नहीं आते. Coming down to injectables and other psychedelics. So psychedelics are medications which alter your brain. That's why they're called psychedelics. Things like mushrooms. According to the research, mushrooms are not very common, or magic mushrooms are not very common in Pakistan. These drugs are usually used by younger people in mostly at upscale or middle class parties, and these mostly are hallucinogenics, and the term used is tripping. So your mind trips and you go onto a trip. So that's what they are. They are commonly these are NDMA receptors, receptor agonists. So things like ecstasy, commonly known as E or even MDMA. These help you distort the perception of reality. You feel music feels better, you feel energetic, you're dancing, you can hallucinate, and colors seem vibrant and things like that. So these are used once again at parties and stuff. So there's more information over here. Yeah, partygoers, euphoria, wakefulness, intimacy, sexual arousal, and disinhibitions. There's also alertness, reduces fatigue, and yeah. So the negative effects of ecstasy can be agitation, nausea, bruxism, which is grinding of the teeth. People would end up doing this constantly. There's ataxia, where people cannot walk properly. They sweat a lot, blurry vision, heart rate is increased. And so yeah, these can be happening with typical doses of NDMA. Once again, not regulated, so you don't know how much you're taking for each dose. Usually classical case is someone goes to a party, a friend gives them a tablet, says, here you go. They use it without knowing what it is. Then rarely used drug now is PCP, angel dust or dust. Rarely used in Pakistan, gives very high heightened energy. You hallucinate. In the medical community, what angel dust or PCP is known as is that if someone has taken PCP, by the end of the night, they would either be in the hospital or they would either be in jail, because that is how strong the effects of hallucinogenics and the alertness and the psychosis there is, that they either end up in the hospital or they end up committing a crime and the police takes them in. Finally, there's ketamine special K. This is basically a horse tranquilizer used in the medical field for sedation. You basically inject it. You can also snort it, but in Pakistan, you can get it from pharmacy. People inject it either into their muscles or in their veins. The same problems as we talked about with heroin, injecting into veins. Even though overdose on this is very difficult, but this can have extreme psychological effects. How the psychological effects of this are that it is a dissociative anesthetic. What happens is that the word explains itself, that it dissociates your mind from your physical body, so you will be laying down straight, not moving, while your mind would be functioning and thinking of things. So you will trip, you will hallucinate. There's something called a K-hole, where you're very static and you travel around the world in your mind and you see things and imagery. Usually very religious imagery pops up. So very common once again at parties, raves, and with people who are with a hippie culture. Okay. Finally, moving on to something which is these days making a lot of news, and other cases that people are talking about. You'd have seen a popular case recently in the news, which was about methamphetamine in Pakistan. The street name is ICE. Makes you do a lot of crazy things. A popular phrase worldwide is meth not even once. So of all the other drugs, are still relatively safe doing heroin once in their life, but methamphetamines are just such a strong drug that just taking them once can ruin lives. There are some horrific pictures online you can see of people who have abused this drug for a long time, and that can really ruin lives. So it is the use of ice or methamphetamines is on the rise in Pakistan. The highest prevalence is in Balochistan and KPK. The typical user is middle-aged male with moderate education. It is the rise of use is in college students and professionals. And when we talk about the effects, we can see why this demographic is affected or is attracted towards drug. According to a survey done last year in 2018 in Karachi, and this is very surprising, is that almost 74% of the people were aware of ICE, both genders. 68.5% of people knew of someone who had used or is using ICE currently. And most of the information people have also gotten about ICE was over the internet. And that's why younger and middle-aged people have more access and knowledge about it. How is it? So how does it look? It looks once again, most of these drugs, like a white crystals or powder, can be slightly yellow in color as well, depending on how it's made. Usually made in a lab somewhere. It's a chemical compound with no longer medical implications, so not used as medication, unlike benzodiazepines or opioids. Local names: ice, meth, crystal, apparently the name called shabu, mostly in Sindh. There's also called speed, and once again the common term powder, which can be confused between this or heroin. So how is it smoked? Once again, smoked in cigarettes, aluminum files. This is a drug which has a special pipe. It has a glass pipe that people smoke it in. So it's called a meth pipe. And also people inject it into their veins or muscles, and they can be snorting this as well. So in this picture, and these two pictures, actually all these three pictures are from Pakistan. This is how the drug looks like, and that's why you can see why it's called ice, because it looks like ice. This is a meth pipe. It's a glass pipe with a round head. You add the crystals in it, heat it up, you inhale, and you get high. Once again, this is how it looks like. Chote packets mein is tarah, people would sell it. It's very cheap apparently. You could get this much for under 300-400 rupees. And this is a makeshift bong from a documentary that I saw from Pakistan. So you see how they've used a water bottle or a soda bottle. They're heating it up on aluminum foil. They're taking the fumes, go in from this end, go in the water, and then come out of the water filtered through this other pipe, and you inhale it. So this is what a makeshift bong would look like. How does it feel? So why are people attracted to it? Why are college students attracted to it? Why are people such as accountants or investment bankers or people who have long shifts are attracted towards it? Is because of these things. It gives a boost of energy. It increases alertness a lot, so you are very vigilant, but at the expense of causing agitation. You're very agitated, very high potential to cause psychosis. So you might, hallucinate. You might, be paranoid or things like that. There's also, euphoria and a feeling of rush. Is increased heart rate and breathing. So the alertness and the boost of energy, it keeps you up can sometimes, depending on the potency, can keep you up for days. So that's why people use it. Exams aa rahe hain, log excuse use karte hain. News mein aajkal tha, people use an excuse. Students use it as an excuse that we have to study a lot, and that's why we'll use this. It'll keep us up for a couple of 12-13 hours. So what are the dangers associated with it? The dangers associated with it are permanent psychosis. Just with one dose, it can cause permanent psychosis. This is a very, very strong drug. And just to give you an example of the origins of this, this was used by Nazi Germany in World War II by their soldiers so that they could fight more, they could not feel the pain, they could keep on going, and they would follow orders and kill a lot of people. So that's where it got its popularity. It can change the structure of your brain very early on, and you can have permanent effects for your life. When psychosis kicks in, you can commit a crime, you can hurt someone, you can drive over someone, you can do things that you would not do when you're sober, but that would not be a defense in court. So if you, for instance, murder someone or shoot someone, you can go serve serious time in jail because of that. So those are things to consider. There's extreme weight loss. If you search online pictures of like meth addicts, you'll see extreme. They lose a lot of weight. They pick on their skin, so they'll have these marks on the skin, and they would peel off their skin just because they think that there's something on their skin. It has terrible effects on teeth. People lose their teeth. Your skin is terrible. Your hair falls off. It does reaches havoc on your physical body as well as your mental state. So very, very dangerous drug, which people apparently are taking very lightly in Pakistan. What are the withdrawal symptoms? So when you stop using this, you'll have something called dysphoria, which is uneasiness, feeling of uneasiness. You don't feel comfortable. You're very annoyed. You're very, just unhappy. You have anhedonia, which is lack of interest in anything, just like in depression. You have fatigue. You sleep way too much because you're being so active in the past. You have agitation, anxiety, depression, suicidal thoughts. So think of it as when you're under the influence that you have things like a manic phase of bipolar, whereas when you are withdrawal, you have the depressive phase of bipolar. So someone might seem like they have manic depression, or they might have bipolar 2, but you need to screen them for methamphetamine or ice use. And we need to tell people about these dangerous consequences of it. What is the treatment? Detoxification, social and family support, counseling and therapy, possibility of a rehab facility admission, and then refer to a psychiatrist who might give them medications such as antidepressants, antipsychotics, or benzodiazepines, or a combination of all three or two, just to calm them down, ease the withdrawal once they're detoxifying. Okay. Then we come to another medication which is similar, and this is a lot of clients use this, and that's what I thought that it would be important to add. It's a medication called Methylphenidate, commonly known as Ritalin. Once again, same demographic uses it. College students more often, seen more in upper middle class and private colleges in Pakistan. It's a medication used for ADHD or ADD in children and adults. It has similar backgrounds as amphetamines, but it does not have the physical features of using methamphetamine. Who is the typical person? And this is once again according to research. Typical person who uses this in Pakistan is a 36-year-old married woman with moderate education, defined as primary or middle. So this is also very concerning, and these are people who were prescribed this medication after children. It was for women, and interesting, if you go into the history of Ritalin or Methylphenidate, when it was first introduced, there were posters and ads, and you can look them up online, that the medication was pushed to people, mostly housewives, and there's very sexist ads online where there's like a woman who is vacuuming, and they say, "Oh, tired of doing household chores? Why don't you try some Ritalin?" Just because it has those same effects with less physical effects, but alertness, boost of energy. You can work for longer. You feel better. You feel. You can do more things with more concentration, and you can see how that comes into play with ADHD. But if you do not have ADHD, then you should not really be taking this. So once again, in college students and professionals, it is very common. You can get it through pharmacies. Now a lot of pharmacies do not keep this because they don't want people to abuse it. So thankfully, but you can find it in the black market. Or if you know someone in the pharmacy who can supply you that. The abuse, thankfully, according to research, has been going down in the past 10 years. My understanding would be that because not a lot of people know about it, and the awareness is being, there's more awareness, but also for the fact that people are shifting to cheaper options, which are ice, which gives a stronger buzz, and is very detrimental, way worse than Ritalin. Anyways, how does Ritalin look? This is right now, Novartis is the only company selling Ritalin in Pakistan. Novartis is formed in 10 milligram tablets. This is how it looks like. It's a white tablet with A or B. In the street, it is known as R or vitamin R, at least in the US. Mostly over here, it's called Ritalin. How people take it is just like how you take a pill, swallowed, or you can crush it and snort it as well for immediate action. And so how it feels like, we talked about it already. This alertness, kick in of energy, there's a mild rush and euphoria associated with it. And that's why that demographic of people take it. What are the dangers associated with it? Permanent changes, once again, very similar to meth, but on a smaller level. Changes to brain structure and function. There's huge dependence. People might be dependent, and then if you don't get that, so if people who are not prescribed this medication, right, they don't have a supply of it, they can't go to a doctor and get it prescribed. And once you cannot find, if your dealer or your pharmacy runs out of it, then you cannot find that medication, and then dependence would be really big of a problem. It can also be a gateway drug to ice, as we talked about, where people develop tolerance to methylphenidate. They cannot afford getting 50 rupees a pill, and it's not giving them the same effects. Someone says try ice or methamphetamine. They try ice, they feel a huge difference, very very stronger, and then they go get hooked at cheaper option, which is ice, but it's very dangerous. Anyway, these people who use it also need to know that this chronic use can be associated with um, heart troubles. So there's hypertrophy of the heart, and even kids who are prescribed it for ADHD are can have these. And there's actually long-term studies that show that Ritalin or methylphenidate is very detrimental for your heart, and that's why there's a balance that needs to be taken, even with people who are suffering from ADHD. So what are the withdrawal symptoms? Very similar: uneasiness, lack of interest, fatigue, sleep, agitation, anxiety, depression. Same things, but on a smaller scale than it was from meth. Detoxification, counseling, it's very similar. Does not really need a rehab unless the problem is really severe, but it would really help if a psychiatrist assesses them. They could put them on antidepressant, anti-anxiety, or antipsychotics as well if needed. Finally, cocaine. This is, according to the UN study, the least commonly used drug, or the least commonly used mainstream drug of abuse in Pakistan. One of the reasons I personally believe that is cocaine is usually produced in South America, Latin America, and it is really hard to get cocaine in here. Even in the US, cocaine is a drug which is usually reserved for the elite. It is a very expensive drug to obtain, and that's why Pakistan does not a lot of people in Pakistan can afford it, so not a lot of people use it. Research shows that typical person using is in his mid 30s to 40s and is a male with moderate education. The only people I've seen use cocaine over here are wealthy landlords, or जिसे वडेरे का बेटा कहते हैं. I've seen come across a couple of cases with people like that who had the money, of course, and where someone was selling them cocaine. Surprisingly, Azad Kashmir had the most number of cocaine users in Pakistan. So here, how does cocaine look like? It's a white powder or a white rock, which is crack cocaine. Local names: coke, cocaine, crack, and once again powder. How is it used? Majorly used as snorting, but can be also, once again, melted down, injected, and smoked in a pipe. So if we go here, picture number 1 is the classic definition or classic picture of cocaine you see in any movie or any TV drama, where you have the powder, you have a razor with which you make lines, which is in picture number 2 here, and you roll up a $10 bill or whatever you have, and you snort it through your nose. The bill is called, or anything you use to snort is called a snorter. Finally, picture number 3, this is in rock form. This is crack cocaine. This is usually smoked in a pipe, very similar to a meth pipe. It's a glass pipe. You heat it up and you smoke. So crack cocaine is cheaper than this high-grade powdered cocaine. The problem with cocaine in Pakistan, as we will talk about in a bit, is that it is not pure most of the times. So how does it feel like? Increased vigilance and alertness, boost in confidence, rush, euphoria, sense of well-being, hyperactivity. The moment you snort it, after a minute or two, you feel very active, agitated. You're like alert. You're looking around. You can work for longer. You have a boost of confidence. All these things that kind of make you able to perform better on the surface, at least. Dangers associated with it. Once again, permanent brain structure changes and functioning changes. Financial losses. It's a very expensive drug. Like if you get a fix or two fixes or three fixes for 10,000 rupees or even more, because depending on the quality, so you can really go down a rabbit hole financially and lose a lot of things. Overdose can actually increase your heart rate to an extent where you will have a cardiac arrhythmia and a heart attack. Um, and this is what I was talking about in Pakistan, because cocaine is not a lot of cocaine is available. People mix it with things like methamphetamines, ice, or any other thing, so you don't know what you're having, and that's really problematic as well. Can be cut with other drugs. There's dependence just like other drugs, and once again, heart problems with chronic use, like we talked about in methylphenidate. Okay, so what are the withdrawal symptoms of cocaine? Very similar: depression, anxiety, fatigue, difficulty concentrating, increased sleep, increased appetite, and increase in vivid dreams, mostly nightmares. Treatment, very much the same: detoxification, social support, family support, referral to a psychiatrist who might see. Medical help is not really needed in such cases. Counseling and therapy, once again, very important. Okay. Finally, we've covered all the drugs that were in the list. Some key points now are other drugs. There's very less used in Pakistan. There's something called LSD, acid. So you drop acid. It's usually on paper blotters. You put it on your tongue, or it's in liquid form. You literally drop with a dropper. It's a long-acting drug, so you might trip for up to 12 hours. Very vivid dreams. You'd see colors. So how it works is it's psychedelic. So you see, you kind of some people have who have used it say that you can almost see sounds and hear visual things. So it's a very trippy substance that is not commonly used. Then there something that is a little more common in Pakistan is solvents and glue sniffing. So Samad Born is a brand of glue that people, kids, once again, young kids who do not have a lot of money, they'll get the glue, they'll heat it up, there'll be fumes in the glue that will be released, and then they wear a paper bag on their face so that all the fumes can be taken in and they can inhale them. A few problems: these are very toxic, they can damage your lungs, anything. Also, once you put a paper bag or once you put a plastic bag on over your face, you can kind of choke yourself and you can die instantly. So that is a problem. Then there's other stuff which is not as hardcore but very prominent, things like snuff, which is chewing tobacco, commonly known as in KPK region as Niswar and in Karachi region as Gutka. While not a hard drug like others, it has its own milieu of things that can go wrong, especially with mouth cancer and dependence on tobacco and nicotine. Finally, also younger people once again use cough syrup. Cough syrup has codeine in it, which we talked about when we talk about opioids, but some cough syrups also have something called dextromethorphan or DMX. Also psychedelic, people use it to trip, similar to acid, or when we talked about ketamine, people would see things and hallucinate if you drink a lot of it. But the problem with that is that when you're drinking cough syrup, that's not the only chemical that's going into your body, so you have a variety of other things that are you're ingesting when you take these things. So that's dangerous and also can cause injuries like other drugs we talked about. So with that, we kind of I covered all aspects or major drugs that there were. I know, I'm sorry, this lecture's already been too long. but I really hope that it was useful. Some of the departing words that I would say about counselors and doctors that when we see patients in addiction, we are here and we should be here to not judge someone. Addiction is a disease, just like there is diabetes. You don't blame someone who is overweight and do not or refuse to treat them just or judge them just because they did not take care of their diet and now they have type 2 diabetes or hypertension or cholesterol levels. We have to be non-judgmental. We have to be welcoming to these people, especially those who are reaching out to us. These people want to change. These people should be helped without us judging them or without us criticizing them. They made choices. Everyone makes choices in their life that they would regret, but we should be here as healthcare professionals to help them and to make them feel better. With that said, another thing that I would want to talk about is with counseling. When we talk to people, not and where we started this lecture saying that only 30,000 people can get help. The facilities for helping people with addiction are only 30,000 when people who are dependent were around 4.3 million people in Pakistan. A lot of these rehabs are very expensive. Even middle class families, even higher upper middle class families, cannot afford to send people in there. What happens is they abandon the kid or they just let them suffer from addiction. That does not have to be the case. A lot of these are in fact manageable. What we need to do is we need to encourage people, we need to encourage the family to come together and for them to help the individual. Our society is very family oriented, and family can play a huge role in the improvement of or the betterment of their loved one, especially when most of the later drugs we talked about were in younger people. Our social structure is so that these people live at home. We need to help the parents come up with better parenting techniques. We tell them these signs and symptoms we learned about the drug. Most of the times they don't even know what drug their kid is using or their child is using or their spouse is using. We need to let them know what the dangers of that drug is. We need to let them know how they can affirmatively address or confront the child or the person abusing drugs. They need to form a better system where the client does not feel judged and is welcomed back into the family or the social structure they're in. So this is really important. Focus on family therapy, focus on individual therapy, set goals for them, and give them hope. There's always hope. And furthermore, once again, reiterating, let's not be judgmental and do not, we should all welcome these people and try to help them. Okay, I have left my email address over here. If you have any questions, feel free to email me, and I would happily answer those questions. So thank you for your time, and until next time.